Is pelvic pain associated with hypermobility? The answer is yes. But then again, pelvic pain does not need, you don't have to be hypermobile to have pelvic pain. So then the question is, what is pelvic pain? Generally speaking, pelvic pain refers to things that may have to do with the inside of the pelvis, which is not the realm that I'm dealing with. I'm talking about, when I talk about inside, I'm talking about internal organs, by the way. And also things that have to do with your pelvic floor dysfunction, which is an issue with hypermobility, as well as Ehlers-Danlos syndrome, MCAS, issues with people with connective tissue disorders, and people who don't have connective tissue disorders, and yet they still have instability there. So I wanted to clarify that pelvic pain can be internal organs, and that's not what we're going to talk about. And it can be musculoskeletal. When it is musculoskeletal, that means it can be the muscles and the bones and the ligaments and the soft tissue that is connected to the pelvis itself. Bear in mind that you have structures above, called your trunk, and structures attached, like your lower extremities, that impact the stability of your pelvis. When you have issues with the stability of the pelvis, you will have issues with the functionality of the pelvis and the internal organs. So for example, instability in pelvis does not cause endometriosis, which is an issue with the uterus. You can have issues with uterus and endometriosis, which now complicate the health inside the pelvis, and the inside the pelvis musculature and soft tissue responds directly to the performance of the outside and the stability and the functionality of everything else that's attached. So while it does not cause endometriosis necessarily, endometriosis can be complicating the health and stability of this, which now adds more to endometriosis. That's just one path that I just walked down and shared with you. So I want you to really look into the depth of what pelvic pain means and understand that you can't really separate the internal organs and the housing of what happens here and the movement and functionality. You are, everything, as everyone says, is connected. So when it comes to someone with pelvic pain, assuming that it is not their internal organs that's causing an issue, then we look at location of the pain, location of, or functionality, I should say, of not just the location of the pain, but everything else that impacts it. For example, your tailbone can cause pelvic pain. And unfortunately, I have personally come across people whose tailbones were removed in an attempt to take away the source of their pelvic pain, which was far from the truth, because that tailbone does have a function, even though we say, oh, that's the process of evolution, etc., etc. The reality is there are tissues connected, ligaments connected to it. Those ligaments play a huge role in the stability and functionality of your pelvis when your pelvis is the base of your trunk. The foundation of your body, with the exception of extremities, upper and lower extremities, is your pelvis. So removing parts that directly impact the structures that are attached to it, where those same structures perform tasks, is going to be a disservice. So when it comes to pelvic floor dysfunction, you don't have to be hypermobile to have pelvic floor dysfunction, yet everyone who is hypermobile has pelvic floor dysfunction. Most people associate pelvic floor dysfunction with incontinence, and that's far from the truth. You can have a bunch of presentations that you may think of as separate problems, like chronic lower back pain, chronic sacroiliac pain, chronic pelvic pain, hip mobility issues, knee issues, ankle issues, poor posture, and all of those contribute to pelvic floor dysfunction. That is why when it comes to hypermobility and connective tissue disorders, I say everyone with the connective tissue disorder has pelvic floor dysfunction. So just wanted to clarify pelvic pain and make you understand that it doesn't always have to be an internal organ issues. In fact, from my perspective, it's almost never an internal organ issues. If you have subscribed to my channel, thank you. If you haven't, this is your opportunity to do so. If you wish to contact my office, please use one of the methods of contact in the description box to contact me. And until next time, take care.